Welcome to this explainer. Today we're throwing on our detective hats to crack a pretty fascinating biological mystery. I want you to think of your own body as a massive, bustling city, and your bloodstream? Well, that's the highly efficient highway system keeping the whole thing running. But what happens when that system experiences a catastrophic failure and life-saving oxygen simply stops arriving where it's desperately needed? That is the exact medical mystery we're unraveling today as we investigate anemia.
So let me ask you something you've probably wondered at some point. Why are you always tired? You know, that unexplained, heavy, dragging fatigue. Maybe you've noticed your hands and feet are constantly freezing, even when you're sitting in a warm room. It's incredibly easy to just write these things off as the normal stress of daily life, right? But what if they're actually the very first clues at a biological crime scene? These aren't just random aches, they're the literal distress signals of a body struggling to breathe at a cellular level.
And look, if you felt these clues, you are absolutely not alone. Look at this staggering data from the World Health Organization. We aren't just talking about some isolated medical anomaly here. This is a massive worldwide health crisis. We're talking 42% of children under 5 years old, 40% of pregnant women, and a full 33%, that's 1 in 3, of all women of reproductive age globally are anemic. The sheer scale of this is honestly breathtaking, which makes it absolutely vital that we figure out exactly what's happening under the microscope.
Okay, let's dive into this. Here is our roadmap for today. We'll cover 1. The oxygen delivery crisis. 2. The common culprits. 3. Rare and genetic suspects. 4. Investigating the blood. And 5. The homeopathic approach. Section 1. The oxygen delivery crisis. Understanding the basic biological failure. So, what exactly is anemia? Well, simply put, it's a medical condition where your red blood cells fail to carry enough oxygenated blood throughout your body. Think of it like this. Your body has a protein called hemoglobin, and it essentially acts as a massive fleet of oxygen delivery trucks. Anemia strikes when you either don't have enough of those red blood cells on the road, the cells themselves are malfunctioning, or your fleet of hemoglobin trucks is severely reduced. Without those trucks, the oxygen just doesn't get delivered, and your body systems begin to stall out. When those deliveries stop, your body starts dropping some major physical clues. Sure, you've got the classic signs like weakness, general debility, pale or yellowish skin, and cardiac issues like irregular heartbeats or low blood pressure. You might get dizzy, have headaches, or faint. But there are also some truly fascinating, unusual manifestations here. Take pica, for instance, a very specific symptom where a person develops wild cravings for indigestible non-food items like dirt or ice. Another really striking clue, the sudden appearance of vertical ridges right on your fingernails. Your body's literally flagging down help in every way it can. Moving on to Section 2, the common culprits, iron and vitamin deficiencies. So the crucial point here is understanding the difference between the two most frequent offenders, iron deficiency and vitamin deficiency anemia. Iron deficiency is by far the most common form in the world. Basically, your body needs iron to synthesize hemoglobin. Without it, the whole assembly line stops. This is often caused by severe blood loss, stomach ulcers, or the high physical demands of pregnancy. On the flip side, we have vitamin deficiency anemia. Your body desperately needs folate and vitamin B12 to produce healthy red blood cells. If you're missing these, whether from a poor diet or absorption issues like Crohn's disease, you can develop what's known as pernicious anemia. So it's different missing building blocks, but it leads to the exact same suffocating result. Next up, Section 3, rare and genetic suspects, aplastic, hemolytic, sickle cell, and thalassemia. Let's compare two really devastating systemic issues, aplastic anemia versus hemolytic anemia. With aplastic anemia, the body completely fails to produce enough red blood cells. It's like the immune system goes rogue and mistakenly attacks its own bone marrow. This can be caused by toxins, viral infections, or a rare inherited condition called Fanconian anemia. But hemolytic anemia, that is a different kind of tragedy. Here, the body is actually producing red blood cells, but they are being destroyed way faster than they can be replaced. This rapid destruction can be triggered by autoimmune disorders or even physical injury to the cells from things like mechanical heart valves. Then we have our genetic suspects, sickle cell anemia and thalassemia. Sickle cell is an autosomal recessive disorder, which just means you'd need defective copies of the beta-globin gene from both parents. This mutation physically alters the shape of the blood cells from nice round discs into abnormal, rigid sickle shapes. These misshapen cells cause blockages in the blood vessels, leading to agonizing pain crises.
Thalassemia, on the other hand, is an inherited defect specifically affecting the alpha or beta chains that make up hemoglobin itself. Depending on the severity, it often requires frequent blood transfusions, which tragically can lead to a dangerous iron overload in the body. Let's hit Section 4. Investigating the blood. Forensics and diagnosis.
Let's move to the forensics phase and see how this builds step by step. When doctors build a case, they use a specific diagnostic escalation. Step 1 is the CBC, or complete blood count, just getting the lay of the land. Step 2 is the reticulocyte count, which checks the bone marrow's production of new red blood cells. Step 3 is the peripheral smear. This is where they are literally looking at the blood under a microscope for visual clues, like giant platelets. And finally, Step 4, the absolute last resort when there just isn't enough data, a bone marrow biopsy.
Now, what's really interesting about this slide is how it decodes all that dense medical jargon using the red cell indices. Look at how logically it breaks down. MCV tells the detective the actual physical size of your red blood cells. MCH measures the amount of hemoglobin inside each individual cell, and MCHC indicates the hemoglobin concentration per unit volume. By looking at these precise measurements, doctors can narrow down exactly which type of anemia is stalling out your body. It's like getting the exact dimensions and payload of those delivery trucks we talked about earlier.
And of course, if iron deficiency is the prime suspect, doctors pull out a specific iron profile. This doesn't just look at the blood, it checks the exact amount of iron stored deep in the body's tissues. They do this by looking at your serum iron levels, your total iron binding capacity, and your transferrin saturation. It's a precision tool to see exactly how depleted the body's iron reserves really are.
Finally, Section 5, the homeopathic approach, targeted remedies for specific symptoms. The source material for this explainer outlines a combination of homeopathic remedies meant to address very specific symptom profiles. For instance, the text indicates ferrum lacticum for cases stemming from nutritional deficiencies, helping to improve energy. Ammonium aceticum is noted for patients experiencing heaviness in the head and a scraping sensation in the throat. Natrum phosphoricum is indicated when there are physical signs like jaundice, sour vomiting, or pale menses. And kali phosphoricum is pointed to for extreme tiredness, vertigo, and offensive breath. As you can see, it's an approach that's highly tailored to the specific physical clues the patient presents.
Continuing with the remedies detailed in the text, we have a few more specific applications. Acidum citricum is listed as useful for severe fatigue and exhaustion, particularly when it accompanies irregular, profuse bleeding. Acidum phosphoricum is indicated for deep debility, nervous exhaustion, an earthy pale face, and even bleeding gums. Lastly, the text points to glycerinum as a remedy for diseases caused by deficiencies, aimed at improving the overall nutritional state in patients suffering from massive exhaustion.
Which brings us to our final thought for today. We've investigated the incredible scale of this oxygen delivery crisis, tracked down the common and rare culprits, and looked at exactly how this mystery is diagnosed. But honestly, the most important investigator in your health is you. From unexpected fatigue to weird cravings and freezing cold hands, your body is constantly communicating its internal state. So the question I want to leave you with today is this: are you listening to the clues your body is leaving behind? Thank you so much for exploring this vital medical mystery with me, and keep